Hello and welcome to our presentation. In this presentation, we are going to explore a fundamental question in the treatment of illness. Is the treatment sometimes worse than the disease itself? To examine this, we have chosen to focus specifically on schizophrenia, a complex and often debilitating mental disorder. Through the lens of the film A Beautiful Mind, we will examine the impact of its treatments, both historical and modern, and question whether the side effects and consequences of intervention outweigh the symptoms of the illness itself.
A Beautiful Mind is based on the true story of the Nobel Prize-winning mathematician John Nash. Nash suffered from schizophrenia, in which he experienced delusions, hallucinations, and paranoia. Those demonstrated in the film was the delusion of a roommate while he studied at Princeton and working for a top-secret government defense mission with high imagined threat from the Russians. Upon diagnosis, he starts taking antipsychotic Thorazine. However, the side effects, namely sedation, means he chooses to stop taking this medication. From this difficult self-medication, he is able to go back to work, winning a Nobel Prize in 1994 for his contribution to economic theory. In this presentation, we want to answer the following questions. Does treatment elicit worse side effects than the symptoms it was administered to treat? Or are these adverse side effects worth it when compared to the hallucinations and delusions specifically experienced by Nash? And how does this apply to the wider schizophrenic population?
Our group chose A Beautiful Mind as our film because it offers a powerful and immersive portrayal of schizophrenia, showing us what it's like to live in a reality shaped by both genius and delusion. The way the film puts us inside John Nash's mind makes his struggle feel real, helping us understand the challenges of mental illness beyond just medical terms. Since the film is based on a true story, it adds weight to the discussion. It's not just fiction, but a real-life experience of someone who had to navigate both his brilliance and his illness. This makes us question how society treats mental health and whether conventional treatments always serve the best interests of a person. One of the most striking aspects of the film is the extreme side effects of Nash's treatment. While medication helps control his symptoms, it also suppresses his intellect, making him feel disconnected from who he truly is. This leads to a major strain on his relationship and career, showing the emotional and personal costs of treatment. Overall, we chose this film because it sparks an important conversation. Is the treatment worse than the disease? A Beautiful Mind challenges us to rethink how we approach mental health, balancing medical intervention with preserving a person's identity and quality of life.
Schizophrenia is classified as a chronic mental illness in the Diagnostic and Statistical Manual of Mental Disorders 5th edition, often known as the DSM-5. It categorises 298 mental disorders based on a specific diagnostic criteria, including symptom patterns and duration, in order to aid the diagnosis of various disorders. For schizophrenia, the DSM-5 highlights that symptoms must persist for at least a year, significantly disrupt daily life, and affect cognition, emotional responsiveness, and behaviour. John Nash's symptoms appeared in early adulthood, which is a typical onset for schizophrenia. It is important, however, to delve into the specifics when diagnosing schizophrenia. According to the criterion A in the DSM-5, at least 2 symptoms displayed on the slide must be present for 1 month. The main one depicted in the film was his visual hallucinations, including imaginary people and friends, like Charles Herman, his niece, and William Parcher, the latter contributing to a severe paranoia. His reduced emotional expression, such as bluntly asking women to sleep with him, also aligns with the schizophrenia symptoms. Interestingly, though, I found this specific portrayal of a schizophrenia symptom amusing and used to create humour, as opposed to the others which I found rather upsetting. Criterion B requires a decline in functioning, and Criteria C states symptoms must persist for 6 months or more. Criterion D ensures that other disorders like depression or bipolar disorder are ruled out, though the film downplays the high prevalence of depression among schizophrenics. Finally, Criterion E specifies that symptoms should not be substance-induced. We found this quote had a lasting impression on us all, and is a good one to kickstart the debate on the question we aim to discuss. It captures the psychological torment of schizophrenia, emphasising the disorientation and existential horror that can accompany the condition. The idea that those experiences might not be lost, but never have existed at all, speaks to a level of distortion that is deeply unsettling. The quote is said by the psychiatrist to Nash's wife as he undergoes insulin shock therapy to induce a coma. Insulin shock therapy, along with other treatments, have debilitating side effects, stripping patients of their autonomy and cognitive function. Although it's important to note here that this is no longer used in treatment of schizophrenia due to its awful side effects, including anxiety, depression, and weight gain. The quote underscores a central dilemma in psychiatry. While treatment is necessary to manage debilitating conditions like schizophrenia, it sometimes comes at a cost that the patients perceive as equally, and if not more, distressing than the illness itself. It raises the ethical question of how to balance symptom relief while maintaining a patient's sense of self and quality of life.
John Nash shows distinctly different symptoms when on antipsychotic Thorazine. The main consensus of the film's portrayal towards antipsychotics is that John Nash loses his cognitive ability when it comes to his career. He claims it's difficult with the medication because it's hard to see a problem when attempting to work on his maths whilst under the influence of this drug. As his work is implied to be highly important to him throughout the film, shaping his character and purpose, this poses the question, is it worth losing your passion in order to control your illness? His medication also had repercussions on his family. As Thorazine is a highly sedating drug, he indicates signs of detachment to those he loves, shown when he stares blankly holding his crying child. This influences his relationship with his wife, not only through emotional numbness but through loss of sex drive. The way in which he becomes during being treated leaves her implying she felt guilty for wanting to leave him. This evidence agrees with the statement that life on medication may be worse than without. Chlorpromazine is the drug that John Nash takes, also known as Thorazine or Largactil. It was the first effective antipsychotic and falls under the phenothiazine class, a first-generation drug. First-generation drugs are also known as typical drugs, usually having less efficacy controlling negative symptoms, such as reduced emotional response and apathy, which is defined as lack of goal-driven behaviour. This can be seen in the film when John Nash loses his motivation in multiple aspects of his life. The side effects of chlorpromazine include sedation, due to blockage of histamine H1 receptors, and also anticholinergic effects. Extrapyramidal and antimuscarinic symptoms are also proven to be side effects of this drug, however aren't portrayed specifically in the film. Extrapyramidal symptoms include tremors and involuntary motor movements, and antimuscarinic symptoms include dry mouth and blurred vision.
Electroconvulsive therapy, or ECT, is a medical procedure where an electrical current is passed through the brain to induce a brief seizure. Despite its controversial history, a modern ECT is a controlled and regulated treatment used primarily for severe mental illnesses. In the film, however, we concluded that this treatment was depicted as a form of torture. It was brutal, involuntary, and unsettling to watch. This is largely due to its early use without anaesthesia, making the procedure appear painful and inhumane. In reality, however, a modern ECT is very different from its past portrayals. Patients who undergo the procedure are usually under a general anaesthetic with muscle relaxants, ensuring they do not feel pain or experience convulsions, as shown in this film. ECT is not forced upon patients, it can be refused, and this is different to other treatments which we will discuss. It's typically reserved for severe depression, bipolar disorder, and treatment-resistant schizophrenia. While ECT is often feared due to its historical use, some may argue that it's more effective and less harmful than long-term use of psychiatry medicines, which can have significant side effects, as those discussed above. Others believe, however, that the invasiveness of an ECT makes it a last resort.
In the film, we see Nash being sectioned by a psychiatrist. Sectioning, approved by the Mental Health Act of 1983, involves the admission to a psychiatric ward, often without consent of the individual involved. As sectioning cannot be refused, the regulations are severe. Therefore, the person involved must be a danger to themselves or to others. We see this in the film, as we see Nash cause harm to his wife and child, and more importantly to himself, as shown by a shocking scene of Nash gouging his arm, trying to find the imagined government chip he used for his missions. While this procedure may be necessary to avoid harm, the process is very traumatic, with a loss of control and potential for poor treatment. This may have been the reason Nash refused to go back to hospital upon relapse of his symptoms, and so had implications for treatment down the line.
Although the film only portrays chlorpromazine as a used antipsychotic, there are many others with different side effects that are commonly used now, and could have been possibly a better route for John Nash to take. Aripiprazole is considered to be a third-generation drug, as it is a D2 receptor partial agonist instead of an antagonist. It is shown to have more benign side effects exhibiting no galactorrhea or antimuscarinic effects. Aripiprazole and hazoprimol are both less sedating than chlorpromazine, which was the main side effect John Nash battled with, therefore suggesting that there were other routes he could have taken. In addition, risperidone has been proven to reduce both positive and negative symptoms. Some drugs have extreme physical side effects, such as clozapine, which may cause agranulocytosis, the loss of white blood cells, leading to increased infection and death. Therefore, patient-specific treatment is so important when dictating what antipsychotic can be beneficial for a patient. Although John Nash is only seen trialling one drug, commonly schizophrenic patients will have to trial different drugs at different doses to find an effective treatment plan.
In the film, we see Nash making the decision to stop taking Thorazine due to the severity of the side effects of the drug, namely sedation. These side effects significantly disrupted his daily life, in that his career, social interactions, relationship and his family were severely affected. We see him feel apathy towards his child, feel embarrassed with taking his drugs around his peers, and having a restrictive routine of taking his drugs. All these factors can contribute towards a patient preferring to come off their medication. Nash stated that, because the ideas I had about supernatural beings came to me the same way that my mathematical ideas did, so I took them seriously. This quote poses the question, can his mathematical genius exist without the schizophrenia? Does losing one mean losing the other? Therefore, by taking his medication, he was also dampening his genius, making him feel disconnected from his passion and his career. By coming off his medication, we see him go on to win a Nobel Prize. Therefore, the cost of experiencing delusions is outweighed by the lack of sedation. Antipsychotics also have a 76% compliance rate, with patients not taking their drugs, in disbelief that they have the illness, forgetting to take their medication, or being unable to deal with the side effects. This is a problem as it causes instability in the patient's illness. Nash also explains that he misses some of his hallucinations and it's hard not to speak to them anymore. This can cause significant distress to the patient, especially if some hallucinations are harmless. Finally, sectioning as a treatment, which Nash underwent, can result in him experiencing even more trauma, adding to his illness.
In A Beautiful Mind, we see how John Nash's schizophrenia profoundly impacts his life. The disease itself is marked by severe paranoia and fear, which influence not only his perception of reality, but also his interactions with others. His hallucinations lead him to believe he is in constant danger, often prompting violent outbursts and behaviour that put him and those around him at risk. This leads him to be violent towards his wife and his friends. Schizophrenia is not just a disorder of perception, it is a life-threatening condition. Approximately 10 to 15% of people with schizophrenia die by suicide, and many more attempt it. The emotional toll of paranoia, delusions, and social isolation can make life feel unbearable, further highlighting the devastating impact of the disease. The paranoia that comes with schizophrenia doesn't just affect the individual, it affects their relationships, their career, and their ability to function in society. Nash's fear of being watched or manipulated shapes his actions and isolates him from people who care for him. This constant state of distrust can be more damaging than any treatment, as it prevents genuine human connection and meaningful support. The social implications of this disease are far-reaching. As Nash becomes more disconnected from reality, he faces social stigma and discrimination. His erratic behaviour causes people to distance themselves from him, and his academic career suffers as he loses credibility. In many ways, the disease isolates him more than the treatments ever could. This leads us to the question, is the disease, with its devastating impact on the mind and social well-being, worse than the treatment? While the side effects of treatment are severe, the disease itself often causes far more immediate harm, affecting every aspect of a person's life, from safety to relationships to career. While A Beautiful Mind is a compelling portrayal of John Nash's struggle with schizophrenia, we need to approach it with caution when considering its accuracy. One major question is, how much can we rely on this film to answer the question of whether the treatment is worse than the disease? The film takes creative liberties with the portrayal of Nash's symptoms. Schizophrenia typically causes auditory hallucinations, hearing voices, rather than the vivid visual hallucinations shown in the movie. Nash did experience delusions and voices, but the film dramatises his experiences by adding detailed visual hallucinations, which are less common in reality. The film also overly simplifies Nash's recovery. It suggests that he overcomes schizophrenia through willpower and rational thinking alone. In reality, most people with schizophrenia require ongoing medication and therapy to manage their symptoms, as this is a degenerative disease. Nash's eventual ability to function without medication is a rare outcome and is not a recommended approach for most patients. Additionally, the film's portrayal of Nash not taking medication could have negative implications. By showing him functioning well off medication, it may lead others to think they can do the same without proper guidance, which is dangerous for people who need ongoing treatment. Another weakness is how the film perpetuates negative stereotypes about individuals with schizophrenia, particularly the idea that they are violent. While Nash did experience paranoia, his real-life delusions were more focused on abstract mathematical concepts, not government conspiracies. The cinematic exaggeration of paranoia and the dramatic portrayal of secret spy operations does not reflect the typical experience of those living with schizophrenia. Additionally, most people with schizophrenia try and use a variety of different antipsychotics before finding one that works for them. As medications affect individuals in unique ways, the process is often long and challenging, involving trial and error to find the most effective treatment with manageable side effects. Finally, A Beautiful Mind presents only one person's experience. While Nash's story is remarkable, it is important to remember that schizophrenia manifests differently for everyone, and this film doesn't fully capture the diversity of experiences and treatment outcomes.
Looking at all the evidence we've explored so far, I personally believe that schizophrenia is worse than the treatment itself. A moment in A Beautiful Mind that really moved me and led me to this decision was the quote discussed above, and the realisation that what you thought was reality was in fact an illusion. The terror of not knowing who is real and who to trust, even among your closest loved ones, is something I can hardly imagine. So for me, this is worse than the sedating or emotional numbness when on some treatments.
I would actually disagree with this and say that the treatment is worse than the disease, as the sedating and emotional numbness that many antipsychotic drugs elicit would detach yourself even more from reality. Not being able to connect as you did before with your loved ones, as John Nash exhibits with his child and wife, for me would be worse than having delusions out of touch with reality. And for me, this film has depicted the repercussions that antipsychotics can have not only on yourself, but the people around you.
I would also agree with this due to the low compliance rates, and that the statistics reflect that patients with schizophrenia struggle to regularly take their medications, further reducing their efficacy. The stop-start nature of this therefore imposes instability on the patient's life, which leads to further detach them from reality.
Actually, that's a really interesting point. I hadn't considered that.
Well, I'd actually say, as shown in the film, a massive part of coping with the disease is having a support system around you, which can make the biggest difference. And also how not taking medication, there is a massive risk of losing that support bubble with the hardships the disease puts on family and friends. I think the patient in a lot of cases would isolate themselves from the loved ones, being worse off in the long run.